My name's Andrew, and thank you very much, Dr. Cranshaw, for inviting me to speak tonight. And I'll be, Professor Lewis has talked about risk factors and things to look out for in mouth cancer. So we're going to briefly look at the mouth cancer examination and also adjunctive techniques for mouth cancer screening. Right, so what is mouth cancer? I'm going to try and stick to 30 minutes. We know that mouth cancer is a serious and debilitating disease that can devastate and prematurely ends life. Now, the next slide, Professor Lewis did talk about the incidence and the importance of detection, but the next slide gives you a few more figures. And really, these figures show us that early detection of mouth cancer is crucial, because early detection of mouth cancer results in 90% survival rate compared to 50% in late detection. But unfortunately, half of all cancers are diagnosed in advanced stages 3 to 4. And by these late stages, the treatment required is systemic disease processes rather than localized conditions as a result of lymphatic spread. And as dental professionals, we are in a unique position to help in mouth cancer diagnosis and discovery, and also educate the public about mouth cancer. Are we doing this? A prime way that we can help our patients is the mouth cancer examination. This is also called a mouth, head and neck cancer screening, a systematic mouth, head and screening examination. They all mean the same thing. And the Mouth Cancer Foundation, which I'm an ambassador for, it recommends that dental professionals carry out a mouth, head, and neck screening on every patient above the age of 16, at least once a year, because systematic and regular screenings saves lives. So what is involved in a mouth cancer examination? It's divided into two components: the extraoral examination and the intraoral examination. Dr. Gilevetti and myself has written quite a comprehensive article on how you can perform a comprehensive mouth cancer examination. It is available online. And if you would like my slides, please contact me, because there will be a few references. And because of time, we will be moving quite quickly. So that's just one paper. I'm sure Professor Lewis has written several papers on how to perform a comprehensive mouth cancer examination. The main thing is we need to do it. And the next slide has been produced by the Mouth Cancer Foundation. We're not going to play it because of time, but the Oral Health Foundation and the Mouth Cancer Foundation have produced videos showing you from A to Z how to do a mouth, head, neck examination taking place in real time. And I'd encourage you to look at these videos, because it just shows you how it can be done. And you have to be very systematic, and you have to document things, so you can see that in place. Why are we talking about COVID-19 tonight? Well, unfortunately, COVID-19 has had a severe impact on everyone's lives, and our profession has not been immune from the effects. We're talking about it a little bit before we started tonight's session. And COVID-19 has really had a profound effect. We know that practices were closed for several number of months in 2020. I know most of you here are, most of the individuals on Pandora are private practitioners. So that meant unless you had insurance, incomes were affected dramatically. But looking, and also we had the lovely fallow times and restrictions. I know the Pandora did a lot to help practitioners get back into work. But the knock-on effect of all of these restrictions on COVID-19 has meant that less patients have been seen. It resulted in a backlog of patients. The BDA estimates that about 1 year of NHS dental appointments have been lost because of COVID-19. And access issues have led to patients who cannot access NHS care. It's led to them seeking private care, which I'm sure you guys are not too displeased about. But because of these pressures that everybody is under, dentistry is very, very stressful at the best of times, but plus putting a pandemic, it's made things very stressful. We may feel that we have to see all of these patients, and we don't have the time to carry out a comprehensive mouth cancer examination on every patient. But the reality is, a thorough systematic mouth cancer head and neck examination can be completed in less than 5 minutes. And it's essential that we spend the time doing this, because as we said, systematic and regular screenings save lives. So that's the mouth cancer examination. It's essential. The second part of this presentation is going to be looking at this subject, which is adjunctive techniques for mouth cancer screening. And detecting mouth cancer at early stages, as Professor Lewis has shown, it can be very challenging, because abnormal lesions, they may not be palpable, and the colors of these lesions can be quite difficult to determine from the surrounding mucosa. So techniques have been developed that can be used in conjunction with the mouth cancer examination to improve the detection of early malignancy. How are we doing for time? Did quite well. The final technique that we're going to look at is autofluorescence, and many of you have probably heard of this or got products. And what is it? Well, cells and tissues, I'll just admit this person, contain molecules called fluorophores. And when fluorophores are excited by light of a specific wavelength, particularly blue/violet light, which has a wavelength of between 400 to 450 nanometers, fluorophores will emit their own light source, light at a longer wavelength, which is green light. And this phenomena is called autofluorescence. And loss of this tissue autofluorescence has been associated with malignant and pre-malignant lesions. So the next slide just depicts this. So we see here in this slide the interaction of blue-violet light with normal and abnormal mucosa. So when cells or tissues are viewed under an optical filter, it allows the passage of long wavelength red and green autofluorescence. So typically, healthy tissues will appear green, they'll emit the fluorescence, while abnormal tissues will appear dark. And this we said because of the changes, the dysplasia and so forth, the changes in the cells, which allows this phenomena to happen. So this is an example of a device that's been used. And one of the things about, unlike the previous adjuncts, you don't need to use any dyes or so forth before using this device. And there's many studies that have looked at the use of autofluorescence devices, quite a few papers to send you if you do contact me or Professor Lewis on the use, and many cancer centers are using this routinely just to observe things. So we can see here a screening device was used, and it revealed loss of fluorescence in one area in the retromolar region. And in this particular case, a biopsy was taken, because these are not diagnostic tools. Okay, so further investigation is needed, and then the patient got the necessary treatment. Another device which is similar, but it's made by a different company, is the BioScreen. It's a biofluorescence screening device. Again, you have a viewing. You have to view the area, so you've got a viewing screen, and then you can use this device in full light due to having 5 violet high power LEDs, which is beneficial. It again also has adapters that are available, so you can use an SLR camera for your SLR cameras, or you can use a phone adapter, so you can again document it. But this is crucial that we understand this, that adjunctive techniques have been developed to assist healthcare professionals to to detect oral mucosal abnormalities. These tools do not replace or diminish the mouth cancer clinical examination. They do not do that, but they should be used, if we are going to use them, to complement and strengthen existing clinical protocols. We need to have clinical protocols. We need to document things, especially the powers that be. We need to document things because it's such a debilitating condition. And they were not designed for diagnosis, these techniques. And as we've said, with any new tool or technology, there is a learning curve, and we need, as professionals, to properly use them. We need to invest the time and to learn how to use these tools or gadgets effectively. So, early detection and diagnosis of mouth cancer dramatically improves survival rates, and it also makes the treatment and rehabilitation easier. Systematic and regular screenings saves lives. As healthcare professionals, are we doing our part to raise awareness of mouth cancer? And that's my bit done. Thank you very much for joining us tonight. There will be a panel discussion. If you want any more information, that's my email address also.